Welcome to the American Lipedema Association, empowering lipedema patients through advocacy. The lipedema community in the United States is already amazing. We have so many patients and medical professionals who are independently sharing information, sharing their personal stories, and educating others about lipedema. And now we have the opportunity to unify and amplify our voices to be able to make lasting change, not only in awareness of lipedema, but to increase research, to demand changes in insurance coverage, and to make a stronger impact in raising awareness and recognition of the disease. Patient unity is crucial. We are 12 million strong at least, and when we speak together from a strategic perspective, we can make big differences, not only for ourselves, but for our caregivers, our medical providers, and our daughters. The American Lipedema Association is a newly formed 501c3 nonprofit organization in the United States. We have already requested membership in the Lipedema World Alliance. This is so important because you have to be a registered nonprofit patient organization to be able to be voting members of the LWA unless you're a medical professional already. Our vision is a world where lipedema is understood, patients have access to care, and we have a unified voice that's advocating for patient needs. Our mission is to advocate for and empower individuals in the United States affected by lipedema. Our mission is not to conduct research or create new materials that indicate that they are evidence-based. We plan to leverage existing materials from organizations that are already doing this kind of work, like the Lipedema Foundation and Lipedema Simplified. The American Lipedema Association has 3 strategic pillars that we will focus on. The first one is advocacy for medical education and disease recognition. The current status of lipedema diagnosis is characterized by frequent misdiagnosis, leading to delayed treatment, prolonged progression, and suffering. We demand that medical education include lipedema to address this issue, not only for physicians, but for nurses and other providers that come across a woman during the course of her lifetime. The second pillar of the American Lipedema Association strategy is advocacy for access to quality care. Our advocacy efforts for access to quality care focus in 3 main areas: advocating for improved healthcare services and treatment options, collaborating with healthcare professionals, organizations, and insurers, and ensuring access to comprehensive specialized care for lipedema patients. The third pillar of the American Lipedema Association strategy is advocacy for consistent and fair insurance coverage. The current status of insurance coverage for lipedema is inconsistent, with only a lucky few getting surgical treatment. Often the rates paid for treatment do not cover base expenses for physicians. We demand consistent and fair payment for lipedema treatments. Together, we can make a difference. By uniting our voices, we can drive change in research funding, get consistent and fair insurance coverage, and disease recognition for lipedema patients across the United States. The importance is that we're all speaking together, working from a strategy instead of having so many independent efforts that are effective but not getting the changes made that we need. You can reach the American Lipedema Association at www.americanlipedemaassociation.org. Call us at 405-358-3638. Email us at americanlipedemaassociation@gmail.com. You can also find us on social media on Facebook, Twitter, Instagram, and YouTube. Please join us. The cost of membership is only $15 for a patient or caregiver, or $50 per year for organizations. And it is not about the money. If you're a patient and you cannot afford the $15 annual fee, please email us at American Lipedema Association at gmail.com to request a financial scholarship, and we will be happy to accommodate you. We want everyone to be included and have the opportunity to be represented by the American Lipedema Association.